Hello, my name is Danny. I'm a nurse practitioner student, and I'm going to be doing your interview examination today. How can I address you?
Oh, my name is Mr. Phillips.
Okay.
Or Mrs. Phillips.
Mrs. Phillips is okay?
Yeah.
Okay.
Yeah.
And Mrs. Phillips, what brings you in today?
I have pain when I pee.
Can you tell me more about that?
Um, Having this pain about a week ago, and it's getting worse.
Worse. Okay. Do you remember any particular event around when it started?
No, I don't remember, but I have to go to the bathroom more often, and it's burn. It looks like it's began soon after my period.
Okay. So you feel like it began shortly after you had your period?
Yeah.
You mentioned it feels like a burning sensation.
Yeah, burning, yeah. Burning.
Do you feel like it burns right as you start peeing, or more once it exits?
Once it exits.
Exits.
Yeah.
Okay. Do you feel like anything makes it feel better, or?
Yeah, it's, drinking more fluids, like cranberry juice, which I thought it helps, but it hasn't helped me that much. I take ibuprofen and that so helps it.
Okay. So the cranberry juice didn't help very much.
No.
But ibuprofen has.
Yeah.
Okay. And how much ibuprofen have you been taking?
Two tablets at a time.
Do you know if that's 200 milligram tablet?
Over the counter, I believe. I would say 100.
Two at a time.
Yeah.
And how often have you been taking that during the day?
Every 8.
8 hours. Anything make it worse?
When I with the intercourse.
Intercourse.
Mhm.
So you have pain with intercourse and just when you pee, is it any other time that you feel like you have pain?
No.
Okay. So it's in the area of your urethra. Do you feel like you have pain anywhere else in that area?
No.
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 Okay. Have you noticed any other symptoms like fever, chills, discharge from your vagina, anything like that?
No.
Okay. Any nausea or vomiting?
No.
Any pain in your back?
No.
So if you had to rate the pain on a scale, 0 is no pain at all and 10 is the worst pain you can imagine, what number would you rate the pain?
Normally the pain is like 3, but when it's bad, it's 7 out of 10.
Okay. And when is it bad? Just when you're going to the bathroom? Or?
And when I pee, when I exercise, when I have intercourse.
Okay. Do you feel like it's worse in the morning or at night at all? Or?
Oh, it doesn't change with time.
Okay. What do you think the problem might be?
The problem may be I never had similar symptoms, but I don't know. Yeah, it's new to me.
Has it had an effect on your daily life?
Yeah, very uncomfortable. I work at a very busy setting, and I have to take time off to come in. It's how bad it is.
All right. So I'm getting that you've had some pain with urination, exercise, and intercourse. Came on about a week ago. Seems to have gotten worse. You had it right after the end of your last period. You've tried ibuprofen and that's helped a little. Cranberry juice didn't help. It's kind of, worse with those activities ranging from a 3 to a 7 out of 10. It's affecting, your ability to stay up with your schedule. Is there anything that I'm missing about the current problem?
I think nothing. You pretty much got it.
Okay.
Mm.
I'm going to go through what we call a review of systems, where I just ask you whether you're having any of these signs or symptoms, and you just say yes or no. We'll just go through them kind of quick, and then if anything, we can come back to them during the physical assessment or when we talk a little more about what could be going on. Okay? So, have you experienced fever or chills,
No,
fatigue, or weight loss or gain?
no,
Okay? Any sweating at night?
no.
Weakness or feeling like you just don't feel run down?
I have that a little bit uncomfortable, because of pain and all what's going on. A little bit tired.
So, like a weakness in your muscles or
Oh,
just
no,
tired?
tired.
Tired, okay. Have you experienced any itching or rashes?
No,
Okay. Any lesions?
no,
Any bruising?
no,
Any changes in moles?
no,
Any bleeding?
no,
Any hair or nail changes?
no,
Have you noticed any pain or swelling in your neck or in
no,
your groin?
no.
Okay. Any change in your appetite?
No, nothing.
Any heartburn or nausea?
No,
Any vomiting?
no,
Any abdominal pain?
no,
Any excessive gas or indigestion?
no,
Have you ever noticed that you look yellow or that the whites of your eyes look yellow?
no,
Okay. Any change in your bowel movements?
no,
Like constipation or diarrhea?
no,
Okay. Any bloating in your abdomen?
no,
Have you noticed any blood in your stool?
no,
Okay. Or any like dark Katari stool?
no,
Okay. And have you noticed any hemorrhoids?
no,
Okay. And so, and then you talked about pain with urination. And you feel like you have to go to the bathroom more? Is that correct?
yeah.
Okay. Have you noticed you need to go to the bathroom more at night?
At night, yeah, in the morning I believe, right? Yeah, nothing.
Okay.
No, it doesn't affect with the time thing. That's what
Um,
I'm supposed to say.
Any difficulty going to the bathroom?
Bathroom,
Difficulty?
burning, only burning.
Only burning.
Mhm.
Okay. Any increase in the amount that you're going to the bathroom and in the amount that you pee when you do go?
I think no change on the
Okay.
frequency, like how often I have to go.
Any incontinence or inability to hold your urine in?
No.
No. You said no flank pain. And do you have any history of kidney stones?
Kidney stones? No.
Any history of a urinary tract infection?
No.
So now we're just going to talk through some of your history, of your medical history, okay?
Mhm.
So as a child, did you have any health concerns? Any surgeries?
No,
Pretty healthy as a kid?
no, yeah, I am.
And then as an adult, um, so you said no history of urinary tract infection at all.
No.
Okay. I'm going to ask you just a little bit about your period, okay?
Mm-hmm.
How old were you when you first got your period?
14.
14. Okay. And when you get your period, how many days does it last?
5 days.
What was the date of your last period?
4 days ago.
Okay. Is it fairly regular or irregular?
Regular.
Do you use pads, tampons, both?
Pass.
Okay. And how many would you say that you need to use on an average day during the period?
4 to 5.
And do you have any cramps, pain with your period?
No.
Okay. Any headache, bloating, diarrhea, mood changes with any premenstrual symptoms?
No.
No. Okay. And then, have you ever been pregnant?
Pregnant. No.
No. Okay. Uh, when was your last pap smear?
A year ago.
Like 1 year ago? Okay.
Yeah.
And have you ever had an irregular pap smear result?
No.
Okay. Any gynecological procedures?
No.
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 Have you ever been diagnosed with a sexually transmitted infection?
No history.
Okay.
But I use the birth control pills for contraception.
Okay.
And occasionally use condom.
Okay. Do you know what birth control pill you're on?
Oh, I have no idea.
Do you take it consistently?
When I have sex with right, I have four partners. Yeah.
Do you ever miss a pill?
Yeah.
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 Okay.
But no pregnancy.
Okay. Um, and do you wear condoms?
My partner will condom, not me.
Well, yeah, sorry.
It's okay.
That's current partners. How many previous partners have you had?
Total of 4. Yeah.
A total of 4?
Yeah.
Okay.
I only see one now.
See one now. Okay. Has your partner ever been tested for an STI?
STI, I have no idea.
Okay.
You asked me about the birth control medication.
Yeah.
I just remember it's I can't say how you pronounce it, but it's Alesse, Alesse.
Thank you. Um, are you currently satisfied um,
Partner, yeah.
with your partner?
Yeah.
Okay. Any issues with uh, lack of orgasm or decreased lubrication with sex with intercourse?
No, no.
No? Okay. Um, any issue with uh, history of um, of using douching products?
No.
Do you use any sprays or powders or deodorants in the area?
No, I don't.
Okay. Um, and then, um, have you ever experienced feeling threatened or unsafe with your partner?
No. It's,
Um, um, do you are you able to frequently urinate and take bathroom breaks throughout your day?
because of the this when I having this painful
Yeah.
urination sometimes, yeah.
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 At work, are you able to take bathroom breaks
Yeah,
as you
yeah,
need?
yeah.
Okay. Um, so in terms of other medications besides your birth control, do you take any
No
medications
medicine.
prescribed?
No.
No? Okay. And anything that you buy at the store, do you take medications that you might buy yourself? Okay.
Yeah.
Any herbal supplements or vitamins or anything like that?
No.
No? Okay. Any allergies to any medications or food?
No.
No? Okay. Have you had the HPV immunization?
Yeah.
Yes? Okay. Do you have the full series?
Yes.
Okay. Have you had a flu shot this year?
Yeah.
Okay.
I'm currently no.
And do you remember when your last Tdap vaccination was?
Oh, I think within the 10 years, but I don't know.
I'm gonna ask you some family history. Um, do you have any family history of diabetes?
Diabetes? No.
No? Okay. And any family history of uh, breast cancer or uterine,
No.
ovarian cancer, or endometrial cancer? Um, so tell me a little bit about your mother. How old is she? She's still alive?
She's still alive. She's 65.
Okay. Does she have any health concerns?
No.
No? Nothing?
The only issue with my family, I think my dad has high cholesterol and high blood pressure. Other than that, everybody.
And how old is he?
He is 75.
Okay. Do you have any siblings?
No.
No. Only child. Okay. Um, tell me about what you eat on an average day.
Vegetables and I try to eat 3 to 4 servings.
Okay. Do you eat meat?
Yeah.
Okay. Eat regularly throughout the day?
Yeah.
Okay. How many hours a night do you sleep?
8.
8. Okay. Do you use tobacco?
Tobacco. Yep, half pack is cigarette per month. Only socially, not every day.
Okay. And when did you start smoking? At what age?
Oh, I don't remember. With means running around.
Okay. Approximately
Maybe
how old?
3, 4. Now I am 20 years, right?
Yeah.
Yeah, 4 years.
4 years ago?
Yeah.
Okay. Okay. Do you drink alcohol?
Yeah,
Okay.
weekend only.
Weekends only?
Mm.
How many drinks at a time do you drink?
I drink beer or mixed drink, 2 beers, 3 beers.
Okay. At a time?
Yeah.
Do you use any recreational drugs?
No. Oh, marijuana. Yeah,
Okay.
my boyfriend brought marijuana and he.
Just how often do you use that?
Oh, several days a week.
And do you smoke that or eat it or how do you take it?
Smoke me.
Okay. Okay. Any past use of recreational drugs?
No.
No. Okay. All right. Have you done any recent travel anywhere?
No.
And what are your current hobbies?
Exercise. I'm so busy, but I will walk my dog.
Okay.
Walking.
And do you are you working? Do you go to school?
Yeah, I'm going to school and working.
Okay. All right. Well, I think that concludes our history taking for now. So we'll proceed with the physical examination. So I'll let you change your clothes and I'll be back.
Good. Before we close, you asked me earlier, and I am too busy remembering stuff. But it looks like I had some kind of infection in the past,
Oh, okay.
like urinary tract infection, and that's what's happening again now.
Oh, okay.
Yeah.
So you think it's probably that
Probably
infection
that's
again.
coming back. Yeah.
Okay.
Cool.
Do you remember
If I were treated, yeah, I had
Yeah.
antibiotic.
antibiotics?
Yeah.
Okay. All right. Thank you.
Cool.